24 of these across the country. We are the one for Maine. They originally thought there'd be 50, that every state would have a co-op. And then sequestration happened and budget constraints happened, and that didn't happen. So a lot of states that had organizations that applied to be a co-op in their state did not, in fact, get approved. We were the 8th, actually, in the country. We're really happy about that. We got our approvals and our loan. We have a loan from the federal government that's $62.1 million from the Center for Medicare and Medicaid. We will be paying that back, pieces of it over 5 years and pieces of it over 15 years. And the things they were really trying to achieve with the co-ops was member governance, so that people were going to have a stronger voice in how their health insurance was conducted. So under the Affordable Care Act, right written into the law, once we have members, we don't have members yet, once we have members, more than 50% of our board will need to be member subscribers of the plan. Very different in terms of our accountability to our members and the ways in which we will be guided by people who live the plan every day. We are also right in Lewiston, as I mentioned. We're Maine driven for Maine people. Our call center's in Lewiston, so people call member services about claims, they're calling Lewiston, unless it's evenings and weekends, and then that overflow will go to our backup. And additionally, the other thing I want to emphasize here is really this enhanced competition and transparency within the health insurance marketplace. So really wanted to make sure in these various states that there was additional competition. Not a lot of insurers here in Maine, right? And the idea was it's very hard for people to get into the insurance business. It basically requires a lot of money up front. So that's why that solvency, the $55 million of what we are granted on our loans, is for solvency, so we can be a functional, around for a long time insurer. And we feel very, there are states, New Hampshire's one, where there is only one insurer on the marketplace. So for people who want to get the advanced premium tax credits, the subsidies, they have to choose from that one insurer. Kind of defeats the purpose around competition. And in terms of transparency, in addition to the member subscribers on our board, we have 2 advisory councils, our Council of Provider Advisors, our Council of Community Advisors, not really snappy names, but that's what they do. People from the provider community, physicians, are really helping us in terms of building our plans and what people need to see, and also community advisors. So we do have people from the farming community on our board. Our community advisory board, we have people from the fishing community and various constituencies who are really interested in new options for healthcare. We actually have people from the arts community as well. So we are an insurance company, though, and people get confused. Are you the exchange? Are you the marketplace? We're one of the insurers. We're one of the options in the game, okay? And we are a nonprofit. So one of the other things that we really feel like distinguishes us, we're not responsible to shareholders. Under the law, again, revenues over expenses get plowed back into making more robust plans, get plowed back into containing costs, and then paying back this loan, obviously. But that is something that we're talking about a lot in terms of the people who choose Maine Community Health Options and how we all get ourselves healthier and how we design our plans is a lot around this sense of how do we contain costs going forward over time, how do we move the needle. So our mission statement, we really want to partner with Maine people, businesses, health professionals. We want to provide affordable, high-quality benefits that promote health and well-being. And we really want to be a leader in transforming the health of Maine people, but really affecting the Maine economy more positively as well. So part of our mission is to reach out to folks who have been uninsured, underinsured, otherwise vulnerable.